Hello and welcome everyone to the diabetes presentation. My name is Lily. I am a registered nurse and a diabetes educator with the Credit Valley Family Health Team. During the next 30 minutes or so, my goal is to present to you what diabetes is, what diabetes isn't, in other words, the myths and facts about diabetes. I will cover the basics of blood glucose monitoring, and that is blood sugar monitoring. I will try and help you to understand why managing blood sugars is so important and trying to prevent the complications associated with diabetes. Our role as diabetes educators is extremely important in helping you manage your diabetes. We are here to support and facilitate the knowledge about diabetes. All of our education is based on Diabetes Canada guidelines from 2018, and all of the information that I'm presenting to you can be found on www.diabetes.ca. So during our agenda today, as I earlier said, we are going to be discussing the myths and facts about diabetes. We'll help you to understand what diabetes is, the basics of blood sugars or blood glucose, and preventing the complications of diabetes. So, what is diabetes? Diabetes is a disease in which your body either does not produce enough insulin or your body does not properly use the insulin that is being produced. Insulin is a hormone produced by the pancreas. Insulin's role is to regulate or control the amount of glucose or sugar in your blood. Blood sugar must be carefully regulated in order to ensure that the body functions properly. Too much sugar can cause damage to organs, blood vessels, and nerves. Your body also needs insulin in order to carry the sugar from the blood into the cells of the body so that you can use the sugar for energy. We'll talk a little bit more about that in a few minutes. There are different types of diabetes. Type 1 diabetes, 10% of people that have diabetes have type 1 diabetes. In type 1 diabetes, it is an autoimmune disease. It's also sometimes known as insulin dependent. People with type 1 diabetes stop producing any insulin and therefore have to go on insulin right from the initial diagnosis. Type 1 diabetes tend to be in younger people. Some children have type 1 diabetes, young adults, and later on in life, people can also develop type 1 diabetes as it has to do with the amount of insulin that is produced from the pancreas. And when the insulin stops producing, or when the pancreas stops producing any insulin, that is type 1 diabetes, okay? In type 2 diabetes, however, 90% of people that have type 2 diabetes have type 2 diabetes. 90% of people that have diabetes have type 2 diabetes, okay? And in type 2 diabetes, the pancreas is still producing insulin. However, the amount of insulin may not be enough or it may not be working efficiently. And then there is the third type of diabetes, which is called gestational diabetes. And with gestational diabetes, it is in women that are pregnant. During the 24th to 28th week of pregnancy, they are tested with a glucose tolerance test. The glucose tolerance test, if it comes back and the blood sugars are higher than normal, they are quickly referred to a diabetes center where they will be seen by a nurse and dietitian. Some are also referred to an endocrinologist as they may need to start insulin. The important thing is that blood sugars are managed during pregnancy because it is very vital for the mother as well as for the baby and the development of the baby. So women with gestational diabetes, we know, are at much higher risk of developing type 2 diabetes later on in life, and therefore must be monitored even after they deliver the baby. And usually with gestational, Once the baby is delivered, the diabetes goes away. But again, they are at much higher risk of developing diabetes later on in life. So here's a question that I'm going to ask you, and just to think about, because I know you cannot respond as this is a pre-recorded presentation. However, I'd just like you to think about this. Stress causes diabetes, true or false? So I'm going to tell you that it is false. Who doesn't have stress in their life? We all have stress in our lives, and we don't all have diabetes. So the important thing is that we know that stress causes people's heart rate to increase, their blood pressure to increase, and their blood sugars to increase. So stress does play a factor in that. If you have diabetes, stress can make your diabetes worse, your blood sugars go up. So it's important that you identify what the stress is, and it may be emotional, it may be physical, but basically try and manage that stress as much as possible, as we know that, stress is very important. I read this thing the other day and I thought it was really, really interesting that you can't know everything about, you can't the past, but change things moving forward. So if you can't change something and it's happened, don't stress over it. Just let it go and try and deal with the stress as best you can. Some people find meditation helpful, yoga, exercise, dancing, praying, but whatever you find that helps you to reduce your stress, the important thing is that you talk to someone about it and we'll try and help you to reduce the stress as much as possible. So what are the risk factors associated with type 2 diabetes? Some of these risk factors can be prevented, and some of them you have no control over. So things like family history. You're born into a family. If your mother, father had diabetes, as type 2 diabetes, as well as your brothers and sisters, chances are you are at a much higher risk of developing type 2 diabetes. If you're over the age of 40, you have a higher risk of developing type 2 diabetes. If you're born into an ethnic background, being of African, Arabic, Asian, Hispanic, Indigenous, or South Asian descent, that can increase your risk of living with type 2 diabetes. We know that if you have high cholesterol or other fats in your blood, you may also be at higher risk of developing type 2 diabetes. Prediabetes, if you've had prediabetes in the past, where your blood sugars are a little bit higher than normal, it can develop into type 2 diabetes if it's not well managed. We know that lifestyle plays a huge factor, because if you are very sedentary, very inactive, and if you eat a lot of unnecessary sweets, and if you're overweight, all of those things come into play and are at higher risk of developing type 2 diabetes. And there are many others. Really to mention, there's a few that you may have heard of: obstructive sleep apnea, PCOS, and even steroid use causes people to have higher than normal blood sugars. And we know that there's a relationship between diabetes and even some mental health disorders. So here we have a picture of an abdomen, and it's just to kind of show you the organs that are involved in diabetes and play a role. So first we have the liver, which is quite a large organ. It is actually in front of the pancreas. The liver's role in diabetes is that it stores and releases glucose or sugar in our blood, especially when we are not eating. So if we fast more than 6 hours, because our bodies need sugar all the time, or especially our brain, the brain sends a message to the liver and says, hey, what's going on? Not eating, I need sugar. So the liver starts to release sugar into the bloodstream. And the liver becomes what's called a leaky liver when you have diabetes and doesn't know when to stop putting out the sugar. So one of the first medications that's prescribed for diabetes, and I just like to mention that here, is the metformin. And metformin works directly on the liver to help reduce the amount of sugar that is released from the liver. So metformin is associated with the liver. It also helps your body use the insulin that's still being produced work better. The pancreas is the other organ here. It's the yellow organ. It sits behind the liver and behind the stomach. The pancreas has many roles. However, with diabetes, the pancreas has specialized cells that are called beta cells that produce insulin. And because insulin is vital to life, we need the pancreas to produce insulin. And what happens in diabetes, as I said, either the amount of insulin is not being produced enough, or the insulin that is being produced isn't working very efficiently. So that's the pancreas. So what is the function of insulin? Insulin's function is really important to understand because, as we said before, insulin is an essential hormone. Without it, we would not be able to live unless we took insulin by needle. Insulin's function is, as I said earlier, it is produced by the pancreas, constantly being produced by the pancreas. Insulin's role is to go into the blood. It actually attaches onto a glucose molecule or a sugar molecule, and it actually takes that sugar and it carries it into the cell to be used for energy. On the right-hand side here, insulin is like a key. It's basically a key that unlocks the lock so that the door to the cell can open. So that insulin unlocks the key, opens the door into the cells of our body, and the sugar enters the cell so they can be used for energy. If we do not have enough insulin, the sugar builds up in the blood and over time causes damage to organs. And not only that, the cells that need the sugar are being deprived of the sugar that it needs for energy. So without insulin, the sugar cannot move from the blood into the cell to be used for energy. So as I said, with type 2 diabetes, we know that your pancreas is still producing insulin. However, it's maybe not enough or it's not working properly. And for some people, if they have very high cholesterol, the door to the cell is being blocked by fat. So therefore, even though there's a key and we're trying to unlock that door, the sugar is having a hard time entering into the cell because of the amount of fat around it. So I hope that helps you understand the vital role of insulin. So how do we know you have diabetes? How is diabetes tested? There's a couple of tests that are done routinely: fasting blood sugar, and that is after you've had after 8 p.m. You have nothing to eat. You can drink water, and the next morning you would go to the lab and have your blood tested. The fasting blood sugar should be less than 7. And then if it is higher than 7, that indicates you may have diabetes. However, they always do a second test, and the second test may be a hemoglobin A1C test. The hemoglobin A1C test, you do not have to be fasting for that. You can go to the lab anytime, because that test basically is looking at a 3-month-old mature red blood cell and the amount of sugar that's attached to that red blood cell. So again, it's a mature red blood cell takes 3 months to mature. And so they count the sugar that's attached to a mature red blood cell, and that gives you an average number of what your blood sugar has been for the past 3 months. You cannot cheat on that test. It tells you exactly how much sugar you have had in your blood in the last 3 months. So again, with the A1C does not have to be done fasting. If it is less than 6.0, it means you do not have diabetes. If it's from 6.1 to 6.4, it means you are pre-diabetes. And from 6.5 and higher, it means you have type 2 diabetes. So usually one test is not enough. If you have a fasting blood sugars that's higher than 7 and a hemoglobin A1C result that's higher than 6.5, then you have diabetes, and the diagnosis is made. If only one of the tests is abnormal, you should have the test repeated. So now we have another true or false question, which I'd just like you to think about. If your blood glucose returns to target levels or normal levels, you are cured of diabetes. Do you think that that's true or false? Just think about it for a minute. But I'm going to tell you that it is false, because if your blood sugar or blood glucose does return to target levels or less than the indications for diabetes, it means that your blood glucose is well managed and your diabetes is well managed, but it does not take the diagnosis of type 2 diabetes away from you. So whatever you have done, then you should continue to do that, whether it means you've changed your diet, started exercising, reduced the amount of sugar that you eat, or started medication. But whatever you have done, you continue to do it, as your diabetes is very well managed. But we do not take that type 2 diabetes diagnosis away from you. So so with regards to monitoring your blood sugars, how do you know how to check your blood sugar and what it is? So firstly, you would require a prescription from your doctor in order for it to be covered by your insurance. And they will look at the prescription and submit it into your insurance for coverage. But if you purchase one, you can walk into any pharmacy and purchase one without a prescription. However, in order for it to be applied to your insurance, you will need a prescription. There are three main systems for checking your blood sugar. The first one is a blood glucose meter or a glucometer. It's on the right upper side there. And with that one, you use a lancet device to make a tiny little hole in your finger. The tiny little drop of blood is applied to the strip, and the strip is in the meter, and that gives you a reading automatically. And that's a blood glucose meter. And there are many different kinds, and they're all good. The second one in the middle there is a flash glucose meter. I'm sure that many of you have heard of it. It's called a Freestyle Libre. It is being advertised very widely. With that one, you would need a prescription as well. You apply this small sensor, as you can see there, onto your arm with an applicator. The applicator just kind of puts it in. It has a tiny little needle in it that stays in, and there's an adhesive around the sensor, which stays in place if you don't hit it hard. It can fall off if you do smash up against it. However, that sensor stays in place for 2 weeks, 14 days. And then you just pass the flash reader over top of it, and it will give you a blood sugar reading automatically. With the flash glucose meter, it really should be used about every 8 hours or so it captures all the information, and it's pretty accurate. The continuous glucose monitor is on the right lower side there. And with the continuous glucose monitor, you may have seen advertisements. I've seen a lot quite recently, athletes that use it, but also older people. But so basically the transducer is also applied with an applicator onto the abdomen. That stays on the abdomen for 10 days. That has to be changed every 10 days. And with a continuous glucose monitor, it is different than a Freestyle Libre in that it actually continuously checks your blood sugar, regardless of whether you pass over the reader or not. It actually has the benefits of warning you if you have a low blood sugar. So for people that are on insulin, have low blood sugars and are not aware of having low blood sugars, or have them during the night and are fearful, it is an excellent meter. But for someone that's just maybe checking their blood sugars once or twice a day, you would be better off just to use a glucometer. The flash glucose meter and the continuous glucose monitor both require, they're quite expensive, but some insurances do cover them. But that's something that you can discuss with your diabetes educator, which one is the most appropriate for you and how often you should be checking your blood sugars. Now, all of the meters are Bluetooth compatible and connect to your smartphone or your computer for easy data review. So what are the blood glucose targets? We use the word targets, meaning what your blood sugars should be. So for most people with diabetes, they would be checking before meals, fasting first thing in the morning within 10 to 15 minutes of rising. And that kind of tells us what's been going on overnight. And it should be 4 to 7. Always, if it's higher than 7, it means there's something that we may advise you, medication may be required, but 4 to 7 is either fasting or before a meal. If you are to check during the day, you would be checking 2 to 3 hours after the start of a meal, and it should be 5 to 10 or 5 to 8 with tighter targets. So those are the targets. I don't want to get too complicated. If you're on insulin, you might be checking it before a meal more than after, but you can discuss all that with your diabetes educator. Here's another question for you to think about. Type 2 diabetes can often be a silent disease and have no signs or symptoms. Do you think that's true or false? And I can tell you that it's very true, because many people have no idea they have diabetes unless they have sometimes the symptoms. The symptoms of having high blood sugars are dry mouth, increased thirst, frequently going to the bathroom or urinating, extreme fatigue or lack of energy, blurry vision. And those are symptoms of having high blood sugars for a while. Most of the time, you would maybe feel one of those symptoms, maybe you would feel two, but you may not feel them all. But we do know that about 10% of people that have diabetes are not aware that they have it. And sometimes it's the complications of having high blood sugars for the long period of time that will bring you to the doctor. And we don't want that. We know that if you're at higher risk, you should be tested, because we don't want you to have the complications of diabetes, which are from having high blood sugars for a long period of time. And I just want to mention here about blurry vision, because often that is the first symptom that people will have. And with blurry vision, it is often associated with the fact that you're in your 40s, you feel like you can't see very well, you think you need glasses, and may go to an optometrist and say, I think I need glasses, my vision's really blurry. And if he was a good optometrist, he would be able to look into your eye and maybe suggest that you may need to be tested for diabetes. So listen to your body, and if you do have any of these symptoms, please go to your doctor and be tested. So when we talked about the complications of diabetes, what are they, and why does this happen? So as we mentioned earlier, the complications can be very devastating. So we want to avoid those as much as possible. We know that if you have high blood sugars, your vision is affected. And with some people, they develop what's called diabetes retinopathy. So really important that you do pay attention. And if you do have some blurry vision, go and talk to your doctor. We know that if diabetes is not well managed and blood sugars are high for a long period of time, you can actually have complications with your vision. And for some people, unfortunately, lose their vision altogether if their diabetes is not well controlled and well managed. We know that your kidneys are affected from having high blood sugars because your kidneys filter all of your blood continuously, and the kidneys retain some sugar or keep some sugar in the kidneys. And when you have diabetes, the amount of sugar that is retained in the kidneys, it increases. So over time, if your blood sugars are high for a long period of time, your kidneys don't function as well and your kidneys become damaged. So really important that we don't get to that point. It's important that you look after your feet when you have diabetes, because over time you will, with high blood sugars that are poorly managed, you lose some of the sensation in your feet, and you're at much higher risk of hurting your feet, getting an infection, cutting your feet, and not really paying attention to it. So the important thing is that you learn as much as you can about how to look after your feet and start paying attention to your feet. We know that the nerves in your body become damaged with high blood sugars, and some people develop what's called diabetic neuropathy and can cause a lot of pain and discomfort. So again, need to maintain good blood sugars. Stroke, you're at much higher risk of having a stroke from having high blood sugars for a long period of time, as well as high blood pressure. So all of these are complications of having high blood sugars for a long period of time. And we want to avoid those as much as possible. And we do know from research and evidence that if you can maintain A1C of less than 7, you are much less risk of developing the complications of diabetes. So here is another question for you to think about. People with diabetes can live a normal life. And now that I just finished telling you about all the horrible complications of diabetes, you're probably thinking, how am I ever going to live a normal life? But I can reassure you that you can live a normal, healthy life if you manage your diabetes and keep your blood sugars in good control. And that's what we're here for, is to help you. So we have this tool, it's called the ABCDESS of healthy living with diabetes. So it is a tool that you will be provided, and our secretary will send you this tool. And basically it's to help you manage your diabetes under our care, of course, but to know what kind of things you should be looking for and managing. So with the A, it is hemoglobin A1C, as I've told you before. A is for A1C, so important your A1C is less than 7, as we know that people that maintain a A1C of less than 7 have much lower risk of developing any of the complications. A hemoglobin A1C does not have to be done fasting, and it is a measure of the blood sugar over the past 2 to 3 months. And it should be done every 3 months until the A1C is at target or less than 7. The next one is B, which is for blood pressure. So we know that blood pressure should be less than 130/80, and your blood pressure should be checked when you do go to the doctor. And if blood sugar is less than 130/80, that's great. And for some people over a certain age, even if their blood pressure is fine, they were put on ACE or ARBs, which control blood pressure, because we know that we need to protect you. So there are certain criteria where you may be put on blood pressure medication and not even have high blood pressure. However, it's just to protect you from having high blood pressure, especially when you have diabetes. C is for cholesterol. And when we talk about cholesterol, we look at the LDL cholesterol, which is the lousy, the bad cholesterol. LDL cholesterol causes atherosclerosis, and LDL cholesterol, when you have diabetes, should be 2.0 or less. Then we also look at the HDL cholesterol, which is your happy, good cholesterol. HDL cholesterol regulates LDL cholesterol and promotes the excretion of LDL cholesterol. So we know that the HDL cholesterol should be greater than 1 or 1.3 for males. So the higher the HDL and the lower the LDL, then you're much healthier. So D is for drugs or medication for diabetes. Now I just want to spend a little bit of time talking about this. Just because you are prescribed medication does not mean that you are a failure. Does not mean that, oh my goodness, my diabetes has gotten so bad that now I need to take medication. And I hear so often from people, I really want to do it without medication. And totally understandable. I get it. But if you are prescribed medication, it's because you have not been able to get your A1C down to less than 7 with diet and exercise and alone and lifestyle changes. The important thing is that you do get help if your A1C stays higher than 7 and you're not able to do it with diet and exercise. The first medication that is prescribed for diabetes is metformin, and metformin works by trying to help your body use that insulin that you're still producing, and also to reduce the amount of sugar that's released from the liver. But there are many other really good medications now for diabetes, and have that discussion with your doctor. And if your doctor prescribes them, try and understand what they're doing for you and how they're helping you. On the right-hand side here is an insulin pen. Insulin is given for some people if no matter what they're done, they can't increase the amount of insulin from their pancreas with medications, or some people can't take the medications. But basically, insulin is necessary in order to get that sugar from the blood into the cell so it can be used for energy. So for some people, insulin is indicated quite early on. The insulin pen makes it very easy to inject, and we can show you how. But basically, insulin is not used as a last resort. It used to be people that doctors would hesitate prescribing patients on insulin until their diabetes got really bad. But now insulin is used. We know that insulin can be used much earlier. And for some people, that's what they need right from the very beginning. So keep an open mind, understand your diabetes, and understand why you are prescribed the medication that you're being prescribed. E is for exercise and healthy eating, very important. With changing your lifestyle when you know that you have diabetes. When it comes to healthy eating, it is not a diabetic diet. It's just really good healthy eating, maybe perhaps looking differently at how you're eating, how often you're eating, what you're eating at each meal, and reducing those unnecessary carbs. E is for exercise. Again, exercise is very important. We know that exercise is important for your heart health as well as diabetes, for everything. So 30 minutes of vigorous activity 5 days a week is what's recommended. And then trying to do 2 days out of those 5 with some resistance exercises. And we know that keeps you healthy and strong, and very important when it comes to diabetes, especially. So now we have the first S, and the first S is for self-management. So we know, as I told you earlier, our jobs as diabetes educator is to help you to self-manage your diabetes, because we know that we cannot be with you all the time. However, it's important that every day you live this kind of life where you're looking after yourself. So we know that physical activity is very important, and to try and incorporate physical activity into your life on a daily basis. Healthy eating, again, looking at what you're eating, what if you're putting in your mouth, making some changes, because for some people it's very minimal changes. For some people it's really reducing certain kinds of foods that they've been eating for the last 30, 40 years. Emotional well-being, as we talked about earlier, really important to be emotionally healthy. Let that small stuff go, focus on yourself, Stay away from negative people. Just try and be healthy and live a healthier life in terms of stress management. When it comes to medication, really important that if you are prescribed something from your doctor, please talk about it, ask about it, find out about it, how it works, how it's helping you, how it's, any potential side effects, but do take it as prescribed. And if you're not going to take it, tell your doctor you're not going to take it. And know your ABCs of diabetes, know what your hemoglobin A1C is, know what your blood pressure is, know what your cholesterol levels are, so that the next time you get tested, you see whether all of the changes that you have made have improved them. And do go to the doctor and have your regular visits. And right now with COVID, people have not been seeing their doctor face to face, but they have been able to go for their blood tests and talk to their doctor as well as their diabetes educator. So the second S is for screening. And this is important because you should be having your blood pressure checked. You should be having your eyes checked every 1 to 2 years. For diabetes, it's a special test. It's not just going for glasses. It's a diabetes retinal test. And if you have diabetes, you tell your optometrist that you have diabetes and you will not be charged for the test. But important, eyes are checked every 1 to 2 years at least. Kidneys need to be checked on an annual basis, and it's a blood test. The doctor should be putting it on the requisition, as well as the A1C kidney function once a year. And then your feet. So with regards to your feet, learn as much as you can about how to keep your feet healthy. Look at your feet, examine your feet on a daily basis. If there's something that doesn't look like it was there yesterday, bring it to your doctor's attention. Learn how to cut your toenails. If you can't cut your toenails, you may need to go to a chiropodist or a podiatrist. But basically, we know that it's very important that you look after your feet to prevent the complications that are associated with your feet and with diabetes. And the last S is for stop smoking. Not smoking is especially important for people with diabetes because both smoking and diabetes narrow your blood vessels. Blood vessel narrowing makes your heart work harder. E-cigarettes aren't safe either. So if you quit smoking, you will lower your risk of heart attack, nerve disease, and stroke, kidney disease, eye disease, and amputation. Your cholesterol and blood pressure levels may improve, your blood circulation will improve, and you may have an easier time being physically active. Ask if you need help. There are many smoking cessation programs out there. And whatever you do, the best thing you can do for yourself as well as the people around you is to stop smoking. I'd like to thank you very much for attending this presentation today. I hope that I have helped you to understand what diabetes is. And if you have questions, save them for your appointment. We'll be happy to answer them when you have your one-on-one appointment. Thank you very much. Have a great day.